1 in Malaysian have mental health issue with highest prevalence among those aged 16 to 19 years as well as those from low-income families. Assalamualaikum and welcome to our Ims Talk Show. I am your host, Naziha Wafi. Why is it important for people to prioritize their mental health? This question will be discussed in this episode. I feel honored to have with us MDD survivor, Dian, bipolar patient, we have Shahira, and Farah, who is the psychologist, and lastly, our psychiatrist, Dr. Atif. Based on the video shown, I would like to ask our bipolar patient, Shahira, since she is suffering from bipolar, what are the impact of this mental health towards the quality of the
life? I feel restless, of course, and have a hard time making a decision because there's too much in my mind. I can't even sleep better than a normal person, which sometimes cause me to take sleeping pills. And my mood changes one time to another, where sometimes I feel so sad, hopeless. I lose interest in activities that I usually enjoy. I normally enjoy it, and also I easily distract with other things which I'm not sure what it is about. Even my appetite change from time to time. That's what I have to experience sometimes, and sometimes it's like rapidly happens to me. Yeah.
Thank you for sharing your own experience and opinion. Honestly, I am very proud that you have the motivation and always try your best to improve your quality of life. From Miss Farah's point of view, how can we manage the bipolar itself?
Thank you, Miss Naziha. So what I would like to share is that since Miss Shah here is still suffering from bipolar disorder, this is because the brain function is involved here, hence why she is still having hard time making decision. Her mood changes from one to another. Her way of thinking, act, and feels are all affected. To make the viewers understand, this bipolar disorder is a lifetime condition where there is no cure, but it can be managed by either taking medications, going to a therapy, or adapting and maintaining a healthy lifestyle. That's all I can say how you can manage this bipolar disorder. It is a long-term treatment.
Interesting and beneficial information from Ms. Farah regarding on the tips how to manage bipolar. Now, I would like to ask Ms. Dian to share her experience as an MDD survivor.
Hi, hello. My name is Dian and I am 23 years old. So in 2019, I was diagnosed with major depressive disorder. I almost lost this battle. I didn't think it was going to get better, but it did. I had anxiety since I was in secondary school. I had the feeling that something terrible are going to happen, and that presented itself and tightness in my chest. I get really shaky. I would have a stomach pain. Those were the physical ways that it came out. So for the longest time, I didn't know that was my anxiety. I think it was normal. Then around my diploma education, I started to get depressed, and it progressively got worse. Everything just seemed kind of gray, and I felt I don't have anything to offer. So from the outside, I hide it very well. I was performed in my education. I hang out with my friends, and I involved in many sports activity. So I didn't let people to see that there was something wrong with me. Then things started to feel very heavy, and I started to self-harm as a way to cope, and I started having a suicidal ideation. Then I told my mom, I don't think I can keep myself safe. My parents were shocked, and because they knew how bad it actually was. It was on Sunday then my mom called a psychologist Malaysia in Mount Kiara. I was evaluated by Dr. Cassandra. So I think it was honestly the first time I was completely open about what was happening, and I told my counseling doctor that I didn't necessarily want to die, and I knew I need a break from all the things that I was feeling, and that seems like it is the only option. Then I remember crying to her and being like, I don't know what else to do and I'm stuck. Then I spent 3 days at the treatment center. At there, I was treated like a person. I felt validated and I had some hope. I knew that when I need help, help is given and it works. Then I knew that the break that I was looking for could be found in hospital room instead of dying. So today here I am, remission from my depression. I'm clean from self-harm and I'm back in the community.
Whoa, such an inspirational story, I would say. Thank you, Miss Dian. So, Miss Farah, do you have maybe some extra knowledge that would you like to share to pertaining to MDD?
Again, thank you, Miss Naziha. So I'm glad that Miss Dian here have survived a toughful disorder and managed to live a healthy lifestyle. Yes, there is some knowledge I will share. Depression can make us have a persistent feeling of sadness and loss of interest. It affects how we feel, think and behave, and can lead to a variety of emotional and physical problems. To some person, they can have trouble doing normal day-to-day activities, and sometimes that they feel that life isn't worth the living. So this major depressive disorder is really a long-term condition and also requires a long-term treatment to get over it. So the best strategy in treating this disorder is by psychotherapy, since it involves cognitive, interpersonal, and behavioral psychotherapy, and it has shown to be effective in treating depression. So I hope whoever had depression, they can come to me and I can somehow help them get over this disorder. Inshallah.
I agree with Miss Farah. Thank you for that. At this moment, I would like to ask Dr. Atif, based on your experiences, how do you handle patients with MDD and bipolar disorder?
Hi, so for my experience on treating people with mental disorder and MMD, it was very hard and we need to be more patient when treating them. I need to look out for their daily routine, as an example, their sleeping hours and time, exercise, and also with their diets. I need to make sure the patient is attracted to go for physiotherapy. In order for them to come to their appointment, I will ask the family and friends to attract them and make sure the patient is come to the appointment routine. I also give their family, friend and advice to help the patient in order for them to understand the patient with mental disorder like bipolar disorder and MMD. As an example, I ask them to give full support to them and give more attention. They also need to check the routine of the patient, and if the patient is drug and alcohol addicted, I will ask their family to slowly remove the drug and alcohol away from their homes. They also need to give their more times to the patient in order for patient to be busy and not think about other else. I need to make sure the patient is taking the right medication on times and not take too much dose by asking their family supports to check the dose for their medication. In order to understand the patient, the family and their friends also need to learn more about the mental health disorder in order for them to understand the patient and give their supports. So in worst case, when the patient starts to rebelling and harm other person, I need to recommend for hospitalization for the treatment. So in the hospital, they can get much more stable treatment, but it is only used for the worst case. I also recommend some program for the patient to follow and provide counseling program to treat their mental disorder.
Thank you, doctor, for your impressive sharing with us today. And I would like to thank everyone who is listening today. My hope is that everyone will be more aware of these mental health issues. Remember, mental health your first priority.